Good evening, everyone. Welcome to Spine Time. Dr. Hartl, please get started.
Hello, everyone. Welcome to Spine Time. My name is Roger Hartl. I'm one of the co-directors of the Center of Comprehensive Spine Care at Weill Cornell and the director of neurosurgery spine at Weill Cornell, NewYork-Presbyterian Ox Spine here in New York. And you may be surprised to see me here today as the moderator and not Ricky Singh. I hope you're not disappointed. I know Dr. Singh has a big fan base out there. He felt a little bit under the weather today, and unfortunately he can't be here tonight, but he's feeling well and he sends you his regards. That leaves me, however, with the pleasure of moderating one of my favorite topics in spine care, and that's tips and tricks for better posture before and after surgery. And I'm joined today by two experts in the field that I will introduce in a moment. But before we get there, a few words about the Spine Center that most of you are probably familiar with, but I want to just mention again, we're part of Weill Cornell, of course, and NewYork-Presbyterian Ox Spine. We're located on 59th Street and 2nd Avenue. We take care of all spine needs that may arise in patients, from diagnosis to treatment to recovery from spine surgery. The special feature really about our spine center is that we combine surgical and non-surgical specialties. We have neurosurgeons and orthopedic surgeons working together to evaluate patients. We have pain management, rehabilitation medicine, sports medicine, neurology. And as you could see a few weeks ago, we had a psychologist here on the program, and we work with psychologists also very closely because we understand that all this is connected and related and can help us take care of patients with spine problems. Now, enough about the background here. Let's talk about posture. And I have two experts here tonight who will share with us their experience and their tips and tricks to maintain and obtain a better posture. We know, and I brought a spine model here to show you how flexible the spine is, and it can go in all directions. And we want to make sure that the spine, however, stays straight because we know that that's associated with less pain and better function in our patients. Now, first, I want to introduce Dr. Paul Park, who is he's an orthopedic spine surgeon. He joined us about 6 months ago on the team here at Weill Cornell. He trained at Columbia. He did a fellowship with Dr. Lenke uptown, and now is an orthopedic spine surgeon within the Ox Spine team. And he sees patients in the Spine Center, I think, on Fridays, and then also at Methodist Hospital. So he has multiple locations where he sees patients. And looking forward to having you here, Paul. Thanks a lot. And then I want to introduce Dr. Boltunova here on the right side. You can see her. She is an instructor in anesthesiology and pain management. She sees patients in the Spine Center on 59th Street, I think on Mondays and Fridays. She also is a clinician. She takes care of patients in the operating room, and I see her frequently in the operating room taking care of my patients when she does neuroanesthesia for the spine team and also for the neurosurgical team. So Dr. Boltunova, thank you very much for joining us here this evening. So we'll get started, and we'll have Dr. Park. He's going to talk to us about some of the anatomical background and basics of spine posture. Dr. Park, thank you.
Thanks so much, Dr. Hartl. So I just wanted to get started and give a basic overview of the anatomy and how our spine anatomy contributes to our posture. And the first thing I wanted to do was go over the different sections of the spine. And the spine is generally divided up into 3 sections. And this is based on the morphology or the shape of each vertebral body. And so the spine is composed of all these different vertebral bones, and they have discs between them, essentially shock absorbers between the bones. And so based on their shape, they have different motions as well that they're capable of doing. And so the neck portion, or the cervical spine, consists of 7 different bones. And then they all have discs between them. These are generally smaller than the thoracic or the lumbar vertebrae. And this allows us to move our head in a lot of different directions. It generally lets us look up and down. It also lets us bend our head back to the left and the right. And then the top two vertebrae, the C1 and C2 vertebra, are responsible for the majority of our rotation of turning our head left and right. And so that's all made possible by the shape of those bones in the cervical spine. The next section of the spine is the thoracic spine. And again, they're shaped a little bit differently and serve a little bit of a different purpose. And there are 12 different bones in the thoracic spine, 12 different vertebrae. And the special thing about this part of the spine is that it's actually relatively stiff because, as you can see, we have ribs coming off of all of these levels in the thoracic spine. As these ribs go to the front and connect with the sternum, it adds a significant amount of stiffness at this level. And so these vertebrae, while they do move relative to each other, actually don't move quite as much as the cervical or the neck and the low back or the lumbar spine. Lastly, when we talk about the low back, we're talking about the lumbar spine. And this is a really, the anatomy here is really conducive to having us bend forwards and backwards, such as touching your toes. And as you can see, these vertebral bodies are bigger. And this is actually where most of the nerves that go into your legs and your feet are essentially passing through. And so sometimes when you have some tightness or compression at this level, it can lead to radiculopathy or pain down your legs. And then below that, there's the sacrum, which is actually all one bone, even though it many years ago may have been separate. It's one piece, and that is all involved with the pelvis. And so the important thing when we're looking at these different sections is to see the general curve when we look at the side. And so we can see that it's not pinned straight on the side, and that's natural. That's what we want to see. And so in the cervical spine, we see lordosis, so that the head is basically turning back a little bit. The curve is turning back. And then the thoracic spine, it's curving forward a little bit, and that's called kyphosis. And then in the lumbar spine, again, we see that there's lordosis. So all these curves are natural. Every patient or every person really has a different morphology and different look to these curves, but that's the general trend in each part of the spine. And overall, the goal is to keep the head over the pelvis. And here we see a little closer example of all the different joints in the back of the spine, and we can see how the shape of each vertebra contributes to the amount of motion and the direction of the motion in each different part of the spine. We can go to the next slide.
Dr. Park, this is fascinating. Thanks for
Yeah.
explaining this. There was one question, since we're talking about the discs and the bones.
Yes.
And I want to encourage everyone, please submit comments, questions. That's what we're here for, and we'll try to address as many of those as possible. There was one question from the audience: does aging always means that you're getting shorter and shorter as you get older, and why is that?
Yeah, absolutely. So that's a good question, and I'm sure many have seen that what appears that people are getting shorter over time. And so that can be due to a couple things, and that's both from the discs and the bones itself. And so those shock absorbers, or those discs between all the bones in your spine, are mostly made up of water. And inevitably over time, those can slowly start to dry out and lose their height. Again, this is completely natural, but slowly they may start losing that height that they had from when you were a teenager. And that can contribute a little bit to the loss of overall height. In addition, as we all age, our bone can get slightly softer as well, and each vertebral body can slowly start to lose a little bit of height itself. And again, completely natural, and for the vast majority of people, it's asymptomatic without any real consequence, but this can also give that appearance of appearing shorter as we get older.
Yeah, that's a very good point. I just want to add that, and this happens even overnight, the discs between the bones lose hydration, and you're actually taller in the morning when you get up. Mm-hmm. And then as the day progresses, as you put the weight on the discs lose water, and you're short at night. And then you rehydrate as you're resting. And that actually has we'll show some pictures about that later. how that affects your posture.
Absolutely. And so this is a concept that we talk about as surgeons and really applies broadly to everyone. And it's this concept that the body wants to keep the skull over the hips and the pelvis and then over the feet. And for us, this is the most efficient position to be in. And that's why that cervical lordosis, thoracic kyphosis, and then lumbar lordosis all balance each other out, where essentially your head is over your pelvis, is over your feet. And when this is disrupted or this is changed over time, depending on degeneration or changes with age, then some people may have some symptoms or pain or discomfort. But in general, the body does an amazing job of keeping the head over the pelvis in that optimal position, and it'll compensate over time. Now, this relates to the question we just heard, but as we were talking about normal changes with aging, what can happen is as those discs start to wear out, eventually you get what we would call bone on bone, just like any other joint in the body, like your hip or your knee. And this can lead to changes in alignment. So you don't have those shock absorbers anymore, and the bones may start to move relative to each other. The vertebral bodies may start to shift relative to each other. And now this, when you're looking face on, as we see on the left, this can mean that you're leaning to the left or the right. Sometimes it's very well balanced, like in this X-ray, where you see still the rest of the spine looks straight above the pelvis. But if the changes are severe, you can start to feel like you're leaning to the left or the right. And then in the X-ray to the right, we see when you lose that normal lordosis in your low back or that backwards curvature, you can really feel like you're starting to lean forward, sometimes even needing a cane or a walker because you're not as able to pull your head back over your pelvis. And then if we go to the next slide, we can see that this overall posture is not just related to your spine, and actually your skull as well as your legs that really contribute quite a lot to it. And so you can see in this X-ray to the right, this is someone who's starting to lose that curvature in their low back and starting to lean forward. But the body, like I said, is incredible. It does a lot of things, including bending the knees and then even extending at the hips to get the head back over the pelvis, back over the feet. Now, what's important when we talk about the legs as well is that a lot of times these changes in posture may be coming from outside of the spine. So even when you're looking head on and you feel like you're leaning to the left or the right, this may be related to changes in your leg length. And over time, your legs can change length for a lot of different reasons, including arthritis in the hip, arthritis in the knees. Surgery for either of those can change your length as well and can make you kind of feel off to the left or the right. And on the other hand, when you're looking from the side, we see that the legs can also be slightly bent or hyperextended in order to change that alignment in terms of feeling like you're leaning forward or leaning backwards as well.
Yeah, Dr. Park, I think what is really fascinating is here, and maybe we should explain that a little bit, is really the change in thinking as we as surgeons over the years, and especially because of orthopedic surgeons who really taught us that you have to look at the whole spine. You can't just look at the cervical or the lumbar or the thoracic spine. If you want to understand the posture and how to improve posture, you got to look at the whole spine, especially if you're planning some kind of surgical intervention, because everything that we do, everything is connected, and everything that we do in the lumbar spine, one way or the other, is going to have an effect on the rest of the spine higher up or vice versa.
Absolutely. Yeah, that's a great point. And when we talk about procedures, even surgeries like fusions, inevitably we talked about how many different segments there are in the thoracic, in the lumbar, and the cervical spine. And even with a small surgery or a small procedure, all those things can lead to changes. And so we generally like to look overall, not only at the spine, the entire spine, and then also the legs and lower extremities to see what contribution that's having to what people are perceiving as changes in posture. So we can really kind of hone in on what's really causing those changes. Absolutely.
Yeah, and I think we'll move on to trying to answer the question, why is posture so important? And I hope that by now all of you, when you're sitting at home, you're straightening out, and like myself, you have a back pillow
Mhm.
when you're sitting, because posture is not only important when you're standing, but also when you're sitting. So get yourself a back pillow on Amazon or one of the stores here in the city, and really use that. It's very important. And posture is one of my favorite topics. And why is that? Because especially after surgery, I see it all the time that patients are in more pain if they don't work on their posture really early on after surgery. And Dr. Boltunova, maybe you can explain to us why is posture so important?
Yes, Dr. Hartl, definitely. So posture is incredibly important and something that should be a focus of our daily lives. We know that good posture can help to minimize strain on our musculoskeletal system, and it can also prevent or reduce pain. On the other hand, having poor posture, such as hunching, having rounded shoulders, or forward head posture, can lead to pain. And there's a number of health problems that can result from poor posture. Some of the common ones include myofascial pain, and this is a topic I'll go into more depth in a little bit later in the presentation. But basically, having an incorrect body posture can lead to muscle tension and muscle stiffness, which can in turn lead to pain in our muscles or in our fascia. Poor posture can also lead to back pain because slouching causes a lot of strain on the upper and lower back. Headaches and neck pain can also result from poor posture because it puts pressure in the muscles of our neck and thus lead to tension, headaches, and also migraines. Poor posture can also cause the spine to shift in position and lead to pinching of the nerves. This can in turn cause numbness and tingling, or even weakness in the arms or legs. Poor posture can also lead to a spine curvature, distorting our natural curves of the spine and contributing to scoliosis. And then additionally, we can see joint damage because having bad posture can put extra stress on our joints and lead to joint pain. And then we also know that balance requires coordination between our nervous system, our muscles, and our joints, and poor posture can throw the system off and cause balance problems, making it difficult to move around. And then finally, slouching can even affect our lung function and the ability of our lungs to deliver oxygen to the vital organs in our body, leading to breathing difficulties.
Well, that's fascinating. It's amazing to see how important posture is. Somebody was asking about the pillow, so I took the one off my chair. This is a little bit too big, in my opinion, but this is the idea. You can purchase these pillows; they're not expensive, and you can strap them on the chair. And I have one at home where I sit at home. I have one in the office, and it really it's very, very helpful, and it really makes you feel energized, and you can prevent all these terrible things that can happen that Dr. Boltunova walked us through. What about posture tips at work, Dr. Boltunova?
Yes, so many of us spend a lot of time in the office, working at a desk, or even working from home. So it's important to be conscious of your posture, throughout this work. People often start slouching after 15 minutes. So I have a little checklist of good posture and some tips to maintain while doing office work. So first, it's important for your head and neck to be in line with your torso. Keep your shoulders relaxed and you can do this by drawing your shoulder blades up, back, and down. And then additionally, if you're sitting, again, you should have a back pillow or backrest supporting your lower back. When you're working at a computer, it's a good idea to keep your elbows close to your body, and also to keep the top of the monitor at or below eye level. Additionally, your hands and wrists should be in line with your forearms. And ideally, you should have a workstation with an adjustable chair, a keyboard, and armrest in order to make the correct changes for your body. It's also important to take frequent rest breaks and to change positions at least every hour, as that can also help to reduce pain.
I was wondering, and somebody was asking, what about a neck pillow at night? What do you recommend? And I think there are a lot of questions about the types of pillows. It's a little bit difficult to show pillows here on the screen, but do you have any, both of you, do you have any recommendations if somebody is asking you, what about a pillow at night? And like when you're sitting, how do you find the right pillow? Where do you go?
Yeah, as Dr. Boltznow said, I think that the key is really to keep your head in line with your pelvis when you're seated. You don't want to be too far forward or too far back. And that translates to if you're laying down or have a pillow when you're sleeping, similar to keep in mind those curves, those natural curves in your neck and your back and your low back. And you don't want anything too high that's flexing your neck throughout the night, but rather something that kind of keeps you in what we would consider a neutral position where you're more in line with the rest of your pelvis as well.
Yeah, so, and it may also require trial and error. I think everybody's a little bit different, and I've looked into that a little bit, and there are pillows that are highly advertised that I didn't like, and others who I liked. At night, I have a very narrow pillow just under the neck, really, just to keep the neck extended a little bit at night. And you can even just use a towel that you roll up, not a thick towel, but a thin towel. You roll that up just as a little bit of a neck support here. So like you said, you don't want something that pushes your head up so you're sleeping like that. That's exactly what you don't want to do. You want something that slightly extends your neck. But not everybody can really sleep like that. So it really depends on your personal kind of preference. But that's the idea. And I think the same with the back pillows when you're sitting at work. You kind of have to try out maybe different types of pillows, or maybe even use towels and roll them up. It's a little bit of a challenge to attach those pillows to the chair, depending on what your chair looks like at work. So there are a lot of little things that you have to keep in mind. But the idea is, of course, posture is so important. I wanted to show you this. I don't want to turn this into a science class. But this is a study that we use in surgery a lot to show to our patients and to educate them on the importance of posture. Because what we do a lot, for example, is we have patients who have herniated discs. Patients have a lumbar disc herniation, sciatica, and, for example, they have an operation, a microdiscectomy, and then the concern is always, well, what happens with recurrent disc herniation? Is that a concern? How often does that happen? And what can I do to prevent a recurrent disc herniation? And this is really where this graph kind of helps you. This is a study that was done, multiple studies that were done, and they actually implanted little sensors into volunteers, into healthy human volunteers, and they measured the pressure in the L4, L5 disc as those volunteers were doing different maneuvers. And the higher the pressure in the disc, you can imagine, the higher the pressure in the disc, the higher the chance that you may develop a rupture and a disc herniation. So those are the things. So the things that cause the pressure in the disc to go up really, really high, those are the things that you want to avoid, especially after an operation for a herniated disc. So the pressure is low, obviously, when you're lying flat. You can see that here in the recumbent position, the pressure is relatively low. Even standing up straight without holding anything, without leaning forward, the pressure is actually not that high. The problem is here, when you stand up and when you lean forward, and especially then if you lift things up, that's when the pressure in the disc goes way up. And that's why we tell patients all the time after surgery, or if they have a disc herniation, even without surgery, BLT, no bending, no lifting, no twisting, because we know that those maneuvers dramatically increase the pressure in the disc, and then can result in a new rupture of a disc or in an old rupture opening up and the patient's developing another disc herniation. So bending your knees, even bending your knees and holding objects that causes very, very high disc pressures. And again, the safest position is obviously lying flat, but also in a recumbent, like here, lying, sitting down slightly backwards, like on a plane. That's actually a very, very comfortable and safe position for the disc. So I just wanted to show that here because it really posture and all these things translate into everything that we do as spine practitioners, not only surgeons, and it's incredibly important. And I put this in here, this is from the publication. Actually, this is a volunteer and they implanted, and this poor gentleman, they implanted a sensor into the disc and they had him lift cases with beer, as you can see here. That's how they measured the pressures in the disc. I found that nowadays, obviously, you wouldn't be able to do that. This is something that I show virtually to all of my patients. This is the example of how you should not do it here. Slouching forward. When you're sitting somewhere, always bring your back pillow. See, I took it off. I miss it already now. I can feel already that I'm not feeling as comfortable without the back pillow. So you should always try to have a back pillow when you're sitting anywhere for any significant time period. And this is really my favorite exercise, especially after surgery, because people don't realize, but what we do in the operating room is we take the pressure off the nerves in the lumbar spine, which is one of the reasons why they're leaning forward. They can't straighten out because the nerves are severely compressed. And once we take the pressure off, they should, and they actually can't stand up straight, but they don't know that they can do that. So that's what we talk about at the first postoperative visit. And I always encourage them, stand straight against the wall, put your head against the wall. You can do that in the elevator. In New York City, everybody uses the elevator. It's always 10, 15 seconds. That's all you need, 10, 15 seconds where you can stand in the elevator and practice your posture. And right there, you have 4 or 5 times a day, you get your little session to practice your posture. And then obviously cell phone, and that's a real problem. And I know Dr. Boltunova wants to talk about that a little bit.
Yeah, so we're all using electronic devices all the time. Unfortunately, electronic devices really are the enemy of good posture. Often our slouch postures occur when we're on our phone, our tablet, or a laptop. So it's very important that when you're using mobile devices such as cell phones or tablets, to sit with the trunk and neck straight and try to limit the frequency that you're using these electronic devices. Another good tip is if you're texting on a mobile phone, it's important to try standing instead of sitting, as that again can encourage better posture instead of like this gentleman sitting in this picture here, you're all slouched over.
What about dictating instead of typing?
Dictating, I think, is also a great option instead of typing, especially if you don't have a good ergonomic setup, as we discussed previously.
Now, what if you, well, I guess this is your next point, is the role of the muscle, right? A role of muscles in posture control and what that means.
Exactly. So muscle pain or myofascial pain is a consequence of poor posture. It's one of the many, problems that we see with poor posture. So what is myofascial pain? So this is basically a pain syndrome caused by the presence of trigger points in the muscle or fascia. And basically trigger points are taut bands of muscle that are painful when you press on them. The pain is often described as being aching. Sometimes it's described as being burning or stinging. And often these trigger points cause restricted range of motion.
We have a question here. Once your spine is unnaturally rounded and the head too far forward, can the spine still be straightened with posture alone? Maybe Dr. Park, what's your experience in your patients?
Yeah, absolutely. I think that that's a great question, because I think that there are people in both camps where some of it can be modified by physical therapy and strengthening. As we see here, there's a really complex network of muscles along the posterior spine that really help us maintain that posture. And so I always think that the first option in that scenario is to do physical therapy. One, because it'll help relieve pain overall, but also with the strengthening can definitely have improvements in posture. After a certain point, when those discs and those bones have a significant amount of wear, sometimes that curvature can become a little more stiff, where the muscles can't really compensate for those changes in the disc health and height and the bone shape as well. And so in those cases, the physical therapy may be limited in its efficacy. And at that point, then you could consider other options. But I always think that physical therapy and muscle strengthening are excellent first options in people who have a little more forward posture.
I was wondering, and patients ask that a lot, what about traction in the cervical spine, for example? It would make sense to me empirically that maybe traction is something to consider.
Yeah, that's also a common question, definitely. And the studies on it there aren't many studies on it to say necessarily if that is beneficial or not. And the other thing is that traction is a momentary kind of aid in posture, in the sense that you're not engaging your muscles necessarily to improve your posture, strengthening your muscles, but it's through the traction that your posture is improved in that moment. And so I do think that some people do feel better using it, even if while it's on. But ultimately, we want to look for longer lasting and more permanent solutions, such as muscle strengthening, physical therapy, and things along those lines.
So traction may be more like a short-term solution, or for short-term pain issues, but not really for long-term posture improvement and correction. Another question here that's really good, brace. We have a lot of patients, especially in the cervical spine. Also, sometimes before, after surgery, we have patients wear braces. What's the role of braces or bracing for posture correction?
Absolutely. So if we just focus on the neck, at least, especially in the post-operative period, if we are doing something like a fusion, or we want to encourage bones to heal together, the brace is an extremely effective tool to help facilitate that by reducing motion. Whenever we try and have bones fuse or heal, it's like gluing two pieces of wood together. And if you're constantly moving those two pieces of wood, it's very hard for that glue to set. Similarly, when we're doing a fusion procedure, or we want a bone to heal, we want to reduce the motion in that initial period, so that the brace is what's helpful for that. On the other hand, if you wear a brace too long, similarly, you can imagine that your muscles are not working. Your brace is actually taking over for your muscles. And if you wear it for that reason, your muscles may actually start to weaken. And so in that case, I think that, again, strengthening and physical therapy are really important to maintain that muscle tone and strength, as opposed to just using a brace long term.
Yeah, that's always my concern with braces. Short-term benefit, but long-term maybe not a good idea.
Exactly.
Two questions for Dr. Bolchanova. One is Maria Perez is asking a recommended sleeping position to promote good posture. Is there anything that we tell patients what's better or what's worse?
I think the best sleeping position is the one that you're most comfortable in. Just like when you're sitting at a desk, it's important to think about, keeping your head and neck, torso in line. Any awkward sleeping positions can potentially lead to pain. So it's just, again, always important just to be conscious of your sleeping habits.
And another question about the correct desk height. How can you tell? What advice do you give patients or individuals with back or neck issues for desk height?
So desk height is going to be different for every individual, which is why it's important to have an adjustable desk if at all possible. because ideally you want to have your hands and wrists again in line with your forearms. So having a desk and having a chair that allows you to do that would give you the optimal height.
Got it. There are lots of other questions. Yoga to correct posture. Maybe we say a few words about that. Any thoughts, anyone? Dr. Park about Baltanova yoga or Pilates, I guess?
Yeah, so on my next slide, I actually have some treatments for myofascial pain that I was going to touch on. So hopefully, I can answer this question here as well. But again, physical therapy is the most important thing for both treating myofascial pain and also maintaining good posture. So physical therapy can involve posture training and also strengthening the muscles and gentle stretching exercises. And yoga does, include a lot of that. So I think a combination of physical therapy and yoga can be very beneficial, especially because yoga can help to strengthen the core and the back muscles. Some other therapies for myofascial pain include massage, which can alleviate muscle pain. Additionally, acupuncture, which basically refers to procedures typically with the insertion of fine needles that stimulate anatomical points. Acupuncture has been shown to decrease pain and also to improve physical functioning in patients who have muscle pain. And it's generally very safe as well. Some other options include trigger point injections, kind of a similar concept to acupuncture, except that it involves insertion of a needle and injection of numbing medicine into tight muscle bands with the goal of breaking up the muscle knots. Some other therapies include laser therapy, which uses the application of a low-level laser, which has been shown to relieve muscle pain by stretching out muscle knots and also increasing blood supply to the muscle. Additionally, applying heat can be helpful, such as with a hot shower or heating pads to help relieve muscle tension. A device called a transcutaneous electrical nerve stimulation unit can be used as well. And this involves sending electric signals from a small device to the painful area through some pads that are attached to your skin. And then finally, there's the option of medications. There's many types of medications that can be helpful for muscle pain, such as anti-inflammatories, which are available over the counter, such as Advil and Aleve. Other medications such as muscle relaxants, steroids, and even nerve pain medications like Cymbalta can be helpful as well.
Yeah, there are two questions about acupuncture. I know you briefly mentioned that, but maybe we should say a few words about that. And so the connection between posture and myofascial pain is poor posture can cause myofascial pain. And then if the muscle is affected and your muscles are painful and are not working right, that can also then contribute to poor posture, right? So it's a vicious circle. That's the connection, correct?
Yes, correct. That's the connection.
And maybe say a few more words about acupuncture, because there seems to be a lot of interest in that.
Yeah, so I think acupuncture is definitely something that's worth trying for muscle pain. It's generally very safe and well tolerated. So I think if someone has an interest in trying acupuncture, I think it's definitely a great modality to try.
Great. Another question, and I think we're almost done now with our time, but and I can feel with this particular individual, it's tough after surgery. Let's say you had a multi-level fusion operation, and Dr. Park, he knows, and I know, and Alina also, we all know what that means for patients, of course. It's, on the one hand, we tell them, well, you got to work on your posture, you got to do physical therapy. It's very difficult to do, Pilates, gyrotonics, yoga. What is it that you tell your patients really who are maybe still in pain, they're stiff, they had major surgery? What do you tell them to do in order to work on their core? Maybe Dr. Park, yeah.
Sure, yeah, I'm happy to answer that question. And I really do understand exactly where you're coming from. I always encourage patients, the first thing to do is just to walk. It doesn't have to be any sort of exercise. It doesn't have to be any sort of specific movement. But I really think that the aerobic exercise not only is helpful for healing, but to make sure that you're moving and not getting too stiff is really, really helpful in the beginning. Because once you start to stay very still, your muscles get more tense, again, like we were just speaking about, and then it becomes even harder to mobilize. And so I always try and encourage post-operative patients, at least, to walk a little bit every day and set certain goals, even if it's 3 or 4 times a day, maybe once around the house, whatever it may be. But getting that ball rolling, I think, is one of the most important things, and why we encourage physical therapy also, if you do stay in the hospital, to get that ball rolling as well. The other thing I will say is that in the post-operative period, you're often prescribed medications to help with your pain. And trust me, I totally understand the desire to minimize taking medications, but those medications are prescribed for a good reason. And it may not seem that you need it just sitting still, but if it's preventing you from walking, there's no need to avoid the medications. They're all written with a very specific prescription and keeping in mind that you just had surgery. So if that medication does help you, at least to get up and walk around and be more mobile, not necessarily that you need it just when you're resting, then it's not a bad idea to manage your pain initially with some medication so that you can continue to move and increase your strength after a surgery, whatever it may be, any sort of spine surgery.
Yeah, I completely agree. The other thing that not everybody has access to, but is a pool. And I just saw a patient from the Emirates who had spinal fusion surgery, and she's flying back tonight actually, and they have a pool at home. So I told them, try to use it every day, walk in the pool. And again, not everybody here has the lucky, the benefit of a pool available, but certainly in the summer, or if you have access, I think that's a great way of really, in a almost weightless environment, to walk, to practice certain movements, to strengthen your muscles. I like the elliptical. For some patients don't like it, but I think the elliptical is a great way to exercise while keeping your back straight, especially a few weeks after surgery. And a recumbent bike. So not a bike where you lean forward, but where you keep your back straight. You can exercise, you can burn calories, really train your cardiovascular system, even relatively early after surgery. All right, so a few words about osteoporosis, maybe either one of you, and then we'll finish up.
Sure, I'm happy to touch on that. I think osteoporosis is, again, a very common thing that we see, especially in people as they age. And again, this can definitely affect posture because the shape of those bones, which in the x-rays shown before essentially look like squares, can slowly start to wedge and look more like trapezoids and triangles over time as that bone starts to lose some of its stiffness. Ultimately, I think that related to posture, osteoporosis is a much more global condition that's important to address. And that could mean speaking with your primary care physician or eventually even an endocrinologist if that's the case. And one of the first things you can do is get an x-ray called a DEXA, which helps us quantify exactly how much bone stiffness essentially your bone has. And that can help us lead treatments, and again, ultimately led by your PCP or your endocrinologist. But it's a great question because it's definitely a major part of posture, especially as you get older.
Yeah, and it's, again, like you said, it's much more important than just for posture, of course. It's really something that everybody should look into as early as possible, especially as a woman, as you maybe get a little bit older. Vitamin D, calcium, talk to your primary care physician, make sure that you do all the preventive things that are so important in preventing and then also treating osteoporosis, and obviously exercise on a daily basis, healthy diet, and don't gain too much weight.
Exactly.
That said, now we're all going to go home and have a big dinner, but keep your back straight while you're doing that. And I want to thank Dr. Park, Dr. Boltanova for joining us tonight. Again, apologies, Ricky Singh wasn't here. I hope I didn't do too bad of a job. We're wishing him a speedy recovery. He's already texting. He may be watching, but he's doing much better. So looking forward to having him back very soon. And all of you at home, enjoy the evening and join us in 2 weeks. I don't know what the topic is, but I'm sure it'll be interesting. And have a nice and wonderful evening.